So we're going to continue back to the startup teams, and our next team is Platform Health.
Hi, we're Platform, and we're working to solve the two biggest problems in the healthcare, in the U.S. healthcare industry today. So, the first one being when you visit your doctor, they don't have all the information that they need to treat you. And the second being that as individuals, we don't play an active role in our healthcare. We're sort of sidekicks, dragged along the current of healthcare, and we're just lost along with everyone. So our solution is to create a third-party, cloud-based system where you can store all of your medical records in one place, regardless of hospital systems or your health insurance. And from there, you can decide to let anyone in the medical field access to your data, to what they need. So, from a hospital standpoint, the biggest problem that they face, one of the biggest problems that they face is interoperability. That means when patients travel between hospitals or they go between hospital systems, it's really hard for doctors to be able to have their data travel with them. So it's a really huge mess in the hospital, in the healthcare industry right now, and then it's one of the things that the incompatibility of EHRs stems from there. So the thing that we're looking to do is to solve it by having one system, our platform system, to be able to let doctors transfer files directly to a patient or to a patient's account, or when another doctor needs that account, they can request it directly from that patient account. As I mentioned before, the user or the patient is a very passive part of the whole healthcare system. They don't really do anything. They don't really interact with their data. We're looking to change that by putting the patient in the direct center, so that they can have control. They can have knowledge. They can be able to control their medical records and really take back what is theirs in ownership. For example, take a cancer patient, for example. If they need to see a new specialist, they can walk into that clinic on the first day expecting to get treatment like it was their 30th day, because they have all their information in one place, in that one platform account. And then besides that, you could be a parent with a child with special needs or even severe allergies. And if you need to send immunization records or IEPs, you can make sure that that school has everything that they need to be able to take care of your child. And one more. Family members, if they get into an accident, they can, and they're just in the middle of nowhere, they have to go to a hospital that they've never been to before. You can make sure that their hospital has all the information that they need to save that person's life. That's what we're working on. So where we are, sort of through the iVenture Accelerator, we at first didn't really have anything. We were sort of working on a blood testing device, but yeah, FDA sort of ruined that, and then we've decided to go to a totally different direction. So it's amazing that through the connections we've gained through the iVenture Accelerator, we've gotten to talk to Christie Clinic, the CEO of Christie Clinic, and they want us to build the system for their 80,000 patients. That's incredible because that makes us a huge player in the space. We are also talking to Carle Hospital down in Champaign, that we want to be able to have an agreement with them, a non-disclosure agreement with them, to be able to iterate with their products and then build systems directly for them. So where we're going now, where we need help is that we would like to work with private clinics, probably in Chicago and Chicagoland. We would like to be able to move forward and establish our full system with them and be able to implement that. We're also looking branch into the different sectors. I talked about the educational sectors before, and I think that's really important, and we really need help with that. Also, the international sector is really something that we'd like to do. So if you have any more questions, feel free to come out to the platform table, and we can answer them there. Once again, we're Platform, and we're working to make sure that your time in healthcare is as clean as possible. Thank you.